Hello everyone, I'm Ali and this is Zehra. And today we are going to be giving a presentation on COVID-19. This is something all of us are dealing with, and we wanted to share some information and ways to stay safe.
Here's a historical perspective on contagious diseases. The infamous bubonic plague affected 25 million people in Europe during the 14th century. Then from 1918 to 1920, the influenza epidemic affected 50 million people or more. From 1981 to this day, AIDS affects over 25 million people and HIV affects 33 million. Recent smaller outbreaks include SARS in 2002 to 2004, which had about 8,000 cases and 774 deaths. The avian flu in 2009 caused an estimated 151,000 deaths. Ebola in 2014 to 2016 caused over 11,000 deaths. And now in 2020, we are seeing COVID-19.
But what is COVID-19? COVID-19 is an infectious disease caused by the recently found virus known as SARS-CoV-2 or coronavirus. Before the outbreak originated in Wuhan, China, in December 2019, there was no information about this virus.
Here are the basics. It's caused by severe acute respiratory syndrome coronavirus 2. Its possible origin is the wet animal market in Wuhan, China, in early December 2019. It's a strain of the same virus as SARS-CoV-1, which affected 8,000 people in 2002 to 2003. There's a 96% DNA match between that and human coronavirus found in a study from February, which suggests link to humans is not direct, but through an intermediate host. Initially, pangolins were suspected, but it doesn't seem like that anymore. However, it is still unclear. It's made of 4 proteins and a strand of RNA, a molecule which can store genetic information. One protein is the spike, which gives the crown-like appearance. 2 proteins sit in the membrane between the spikes to provide structural integrity. And the 4th protein is in the membrane and acts as a scaffold around the genetic material.
All countries have to play a part in changing the course of this pandemic.
This is what the virus looks like. How does the virus spread? This virus can spread from person to person through small droplets from the nose or the mouth when the infected person coughs or exhales. These small droplets land on surfaces, which means any person that touches these surfaces and then their eyes, nose, or mouth can become infected.
But how does this virus actually affect the human body? As we said earlier, the virus enters through the nose, mouth, or eyes. It then attaches itself to cells in the respiratory tract, producing a protein called ACE2. After this, it fuses with the cells and releases the RNA. The hijacked infected cell now starts producing proteins based on the instructions from the virus's RNA. This is so effective because each infected cell can release millions of copies of this virus before dying. This is rather hard to understand, so here's a simplified version. The virus affects the upper respiratory tract, which includes your airways from the nose to vocal cords, and can even spread to your lungs. In serious cases, the immune system can overreact and attack lung cells. In some cases, the infection leads to acute respiratory distress syndrome and possibly death. The virus can also end up in droplets that escape the lungs through coughing or sneezing. This leads to contagion directly to other humans or indirectly through contaminated surfaces. Soap destroys the virus because its molecules can wedge themselves into the membrane and break it down, which is why it's so important to properly wash your hands during this time. Asymptomatic people. Many people infected with COVID-19 show mild symptoms, especially during the first stages of the disease. Thus, you can still catch the disease from an infected person who only has a mere cough and does not feel ill.
Symptoms of the virus include tiredness, the body feels without energy; high fever, the body temperature can exceed 37.3 degrees Celsius; dry cough, constant coughing without expelling any mucus; and difficulty breathing.
These are the common symptoms. However, the spectrum varies and can also include muscle ache and gastrointestinal issues.
What to do if you're feeling sick? As said before, symptoms and their severity can range from mild to severe. There aren't specific treatments for coronavirus, and there's no vaccine that protects against it. It's important to remember that most people with common human coronavirus illnesses will recover on their own. But if you are feeling unwell, you should get medical advice from a healthcare professional. Call your doctor, Telehealth Ontario, Toronto Public Health, and let them know the situation. Be sure to tell them if you've traveled recently or been in contact with a large crowd and what your symptoms are.
So let's say that you or someone you know is showing symptoms of COVID-19. What should you do? Step 1. Make sure that these are COVID-19 related symptoms, such as a dry cough, fever, or difficulty breathing. Step 2. Call the designated phone number for your region. Step 3. You will be given a test over the phone.
Step 4. Patiently wait for the test results. And step 5. Follow instructions provided by the doctor.
We have provided a list of COVID-19 assessment centers in Toronto.
COVID-19 characteristics. The virus appears to be highly transmissible, and the average patient infects 1.6 to 2.4 other people. The virus disproportionately affects older patients. Fatality rates in the 70s is 3 to 4 times larger than the average. Under 40 seems to be around 0.2%. Men are twice more likely to get infected than women. However, many factors still remain unclear, such as what is the extent of undetected cases due to mild or no symptoms or lack of testing, whether asymptomatic individuals can transmit the virus, and how long is the incubation period, whether recovery implies immunity and for how long, and whether the virus is seasonal and will decrease during spring and summer.
Many people recover from this disease without needing special treatment.
But what can you do to stay safe? Drink plenty of fluids. Hydration is your friend. Get lots of rest. This is a good time to binge a new show or do some journaling, and sleep as much as possible. To help with a cough or sore throat, you can use a humidifier if you have one, or take a hot shower. Stay at home. Physical distancing or self-isolating are both good ways to make sure you don't get anyone else sick.
How can I help? Cover your coughs and sneezes. Wash your hands, and if you can find one, wear a mask to cover your nose and mouth. If you do not have a mask, some people have been finding alternatives, such as using a scarf. Improvise. Any protection is good.
So we've brought up self-isolation, but how do you properly self-isolate? Stay home. Only leave if it is absolutely necessary. Avoid having visitors or visiting others because it puts you and the other person at risk of contracting the virus. If a visit is necessary, maintain a 2-meter distance between you and the other person.
How to properly use a mask. Before wearing a mask, wash your hands with an alcohol-based disinfectant or with soap and water. Cover your mouth and nose with the mask and make sure that the mask is firmly pressed against your face. Do not touch the mask while you are wearing it. If you do, wash your hands with an alcohol-based disinfectant or with soap and water afterward. Replace the mask as soon as it gets wet and do not reuse disposable masks. Remove the mask from behind. Do not touch its front side. Throw it away in a closed container and then re-sanitize your hands.
What are the current drug efforts regarding COVID-19? Scientists are focusing on already existing drugs. Many approaches are being tried, such as targeting replication ability of virus, stimulating immune system to shut down protein production, decreasing the overstimulation of other parts of the immune system. There is now a lower number of cases in China, which means trials are now being set in other places. Scientists are planning trials in places that will face more cases soon. WHO is working on protocol to pool patients from many countries in standardized trials. However, the fast ramping up of production can be challenging.
COVID-19 affects more younger people, but it is more fatal to the elderly.
This graph displays how the elderly are more at risk of dying from the virus, but every age group is able to contract it.
Recently, the World Health Organization marked COVID-19 as a pandemic. But what is that? Here is WHO's definition. A pandemic is the worldwide spread of a new disease. An influenza pandemic occurs when a new influenza virus emerges and spreads around the world, and most people do not have immunity. US CDC's definition is a pandemic refers to an epidemic that has spread over several countries or continents, usually affecting a large number of people. This is a declaration about geographic spread, not about the severity of the disease.
So, in summary, COVID-19 is the worst health crisis of our times. Younger people are far more likely to be infected as carriers, but it's more fatal to the elderly. Many countries are facing strong excess demand for healthcare due to too many critical patients for too few ICU beds and ventilators. Expanding healthcare supply requires turning hotels, barracks, parking lots, and possibly schools into ICUs, and converting selected manufacturers into ventilator makers. There are not enough medical personnel. Recall retired nurses and doctors, train police officers and volunteers, while the Army carries out police duties.
So, what should you be doing during this time? Protect yourself, sanitize your hands, keep distance, avoid touching your face, cover your nose and face when coughing. If you are showing symptoms, seek medical attention, and most importantly, follow the directions of the government.
Further resources and information can be found on Ministry of Health Ontario.
Thanks for listening, and stay at home and stay safe.